To everyone out there in YouTube and TV land, thanks for joining us. I am your host, Dr. Monique Lescott. For my regulars, welcome, and for my newbies, welcome back. I am with collaboration with the St. Kitts Nevis Medical and Dental Association and ZIZ to bring you I think it would be the last episode of Healthwise for 2024. Thanks for having me and good evening again. I have with me two guests, one Dr. Matthias Offrey and Mrs. Lucine Pemberton Vaughan from our Ministry of Health Promotions Unit. Okay. And as you can tell, we have a very interesting topic for us coming on to the carnival season, coming on to the festive season. We thought it would be fitting as it's World AIDS Day today. Is it today?
On Sunday.
It was Sunday, so we celebrated today. It's very fitting that we have sexual safety, STD, HIV awareness for the final show of 2024. And so, again, I'll introduce to you Dr. Matthias Offrey.
Thank you. It's a pleasure to be here. As Dr. Lescott just indicated, I am Dr. Matthias Offrey. I'm the National AIDS Program Coordinator. And beside me is my colleague,
Lucine Pemberton Vaughan, Health Educator and Counselor.
Thank you guys for stopping by at our show. And just quickly, can you guys, anyone, just let the public know what exactly does the health promotions?
Yes, so we talk a little bit about the health promotion and also the National AIDS Secretariat. Yes. The health promotion unit is a combination of different programs, right, to actually showcase or advocate and also bring awareness on general health. And for the National HIV/AIDS program or National AIDS Secretariat, we deal with infectious diseases that has to do with HIV and other STIs. So on the National AIDS Secretariat, we are a national HIV response team that work closely with other international partners and ensure that we bring awareness on HIV and together join to eliminate, if not completely eradicate, HIV infection in the Federation. Wow. And to meet the target, the UNAIDS target of 95 targets, that is 95% of persons being knowing their status, 95% of persons that are under treatment, and 95% of persons that are virally suppressed.
Awesome. Wow, that's like quite a lot of responsibility that you just, that's quite a lot you just said in like less than 5 minutes. So we're going to take a short commercial break, and when we come back, of course, we'll elaborate more on what we just mentioned before, okay?
Guess what? What? September 2024 marks the official start of Aspire.
And our government has a super cool gift just for us.
$1,000 in saving and investments.
$500 will be held in a savings account.
That will go as you go.
And $500 in shares kept safely until you are qualified to access it.
And it belongs to us. Not mommy, no daddy.
And not only that, you'll be learning all about how to manage your money wisely at school too.
Yes, all children ages 5 to 18 who are citizens of St. Kitts and Nevis
and registered at a school, including homeschool, will qualify.
I can't wait for September 2024.
But I am the first group ever to benefit from this program.
Yay! To saving, investing, and
watching our money grow.
Welcome back. Thanks for joining us again. This is Healthwise. I am your host, Dr. Monique Lescott. I have with me Dr. Matthias Offring and Mrs. Lucine Pemberton Vaughan from our national
AIDS Secretariat.
AIDS Secretariat in the Federation. So I will take the floor back to Dr. Matthias so he can elaborate for everyone what exactly is HIV.
Thank you so much, Dr. Lescott. Once again, HIV is a virus. It's called human immunodeficiency virus. And this virus can be contracted through few various means, and where that includes unprotected sex, that can also include infected blood, that can also include other breast milk, and we also have mother-to-child transmission, but we have achieved elimination of mother-to-child transmission in the Federation, which is a big kudos to the Ministry of Health. And talking about HIV, we're talking about the infection. But these are the means at which you can acquire HIV. But the next step is how can we prevent HIV? Because our major vision in the National AIDS Secretariat is prevention, care, and ensure support. All right, so prevention, how do we prevent HIV being spread? Because we've had HIV since almost 20-something years right now. And yes, in this Federation, we have been fighting seriously to ensure that we eliminate or possibly reduce the continuous infection of HIV in the Federation. With my colleague here, I'll give her a little chance to talk on the aspects on prevention, the ABCs of prevention, so we can really understand how we can actually prevent the exposure to HIV.
Thank you, Doctor. And it is really that easy as ABC. A stands for abstinence. Abstinence is still an option. You really don't have to do it, Dr. Lescott. If you don't do it, you won't die. So A is for abstinence. B is for be faithful. The truth is that if you have one partner who is not infected and you are not infected, then really there can be no transmission. But because I am not 100% with my partner, I really cannot be 100% sure. So this whole be faithful notion, it's very good, but how am I sure that my partner is also faithful? So that leads us to the big C, which is correct, consistent condom use. It means that you have to use it every time. Literally every time. There are no off days, and you have to use it correctly. So you have to make sure that there is the space at the top. You have to ensure that you use water-based lubricants. You have to ensure that it is stored in the proper environment, and all of that, not too hot. So that is correct, consistent condom use. And D, do the test. Because HIV can be in a person's body up to 10 years without any signs or symptoms. There is really no other way to tell if you are infected, to know if you are infected. So you have to do the test. Now, in doing this test, there is that 3-month window period. So if I was exposed to the virus, I should be doing that test somewhere 3 months afterwards, when the body has created the antibodies to fight that virus. And we are looking for the antibodies. So it must be
3-month period, you call that the
window period.
Yeah, the window period, yes.
Yes, so that's A, B, C, D. Do the test and educate yourself. There's power in knowledge, and information is out there. And we are here to share, so you can call us to your various groups, churches, any sort of HIV information that you need.
So then persons can write to the Secretariat and request,
of course,
a lecture or a group talk and
demonstration.
And
even
how much
screening.
weeks in advance would you need notice? And
just about a week.
Wow.
just about 1 week.
That's a very quick reaction time. I like
and
that.
Persons have called us in 3 days' time. As a matter of fact, persons have called for counseling, and we have done home visits.
Really?
So we love the job. So
that's
we
awesome.
go above.
So is there like a hotline? Is there a number of persons call for counseling?
We have our own hotline, and I mean, persons actually call me in the night. We work 24/7. We are just here to help the general public. So if you have an issue, a burning issue, if you want to know something tonight, before you go out tonight, you can call us. Well, doctor, you are married, so I'm not sure. But my number is 664-2939.
That's awesome.
So that's that's A, B, C, D, E, and F. We have to fight stigma and discrimination. And we find that the stigma and discrimination actually fuels the HIV.
You know, with the objective of reducing new infection, continued infection in the Federation, we have laid major strategies to ensure that the services we render, you know, it's available, accessible, and it's actually free. As my colleague rightly indicated, we go to schools, we go to churches, we educate people, we ensure that they're tested. We make it, in fact, in all the health centers in the Federation of St. Kitts and Nevis have available trained testers to ensure that if you walk in, request for test, you can get the test and get a result in 15 minutes. Wow. In fact, I tell my clients whenever they come, I tell them what I have is iPhone 16 Pro Max. In other words, it is fast and efficient. In other words, you come in before you leave, you know your status. And don't be scared. I think one of the concerns people have is the fear factor. It limits people from actually going forward to know their status. The best thing to do is to know your status. As we rightly indicated, HIV is not like makeup. It's not like clothes that we wear that you could actually see on people. So you only know your status by getting the test done. Awesome. And through that, we provide the services on treatment for you.
I like this very well-rounded 360 approach, which means that person should really take advantage of the knowledge that we share tonight. We're going to take a short commercial break and have a word with our sponsors, and we'll be right back.
It's okay to party. It's okay to drink. But it's never okay to drive after drinking at a party. Make it a night to remember, not a night to forget. Stay alive. Don't drink and drive. Make the right choice. St. Kitts and Nevis.
We never know when a storm may strike, but we can be prepared. At Skelec, we work tirelessly to keep our customers connected. When a storm is approaching, we activate our hurricane preparedness and response plan. After the storm, our response teams will assess the damage to our network. If you are daring enough to go outside after the storm has passed, don't touch any downed power lines and stay clear of sparking wires. We'll need you to remain patient as some restoration work may take longer than others. Before restoration work begins, we will fix any damage to our power plant and transmission lines. Then we'll restore power to priority areas, beginning with essential services like hospitals, police stations, and water pumps. After that, we'll restore power to the largest number of customers on one feeder, which will take the shortest amount of time. We will then restore power to smaller feeders and individual customers with isolated problems. Be sure not to worry. Skelec is right here with you when you need us most.
And welcome back. Before we took a break, we were elaborating on what the HIV/AIDS Secretariat, what all the services, and I think that's just a small part of what you guys would offer. So we're going to stick a thumbnail in that, and we're going to have our update on medical news from our Director of Services at JNF, Dr. Jensen Morton.
I'm Dr. Jensen Morton, the Director of Health Institutions, and I'm here today at the back part of JNF General Hospital. So for those that need a little history lesson, JNF Hospital, it was first built on this location in 1966, and it was built by the British colonial government. And it would have been destroyed by some successive hurricanes in the 80s and the 90s. Because of the extensive damage, that was why the current JNF hospital, which is the newer version of the hospital, was originally constructed in 2001. Now, some of these older parts of the hospital, we found ways to integrate them into the general hospital framework and to repurpose some of the buildings. So one of those areas is where I am right now, where the CSSD is located. That's the Central Sterile Supply Department. And the CSSD is important because all of the nation's surgical equipment, all of its cotton, all of its gauze, all of its metallic instruments that are in repeated use, this is where they go to get sterilized. They get scrubbed, cleaned, soaked, steam cleaned, and processed in the autoclaves to ensure that they are free of any infectious organism. Now, the CSSD, it had gone through some trials and tribulations over the years, just like most of the parts of the hospital, and it had fallen into some states of disrepair. So we decided to take the initiative and to get this room repaired and optimized such that we do not compromise the integrity of the sterility of the general area that we're using for sterilization, ironically. So behind me is a new autoclave machine, a new industrial autoclave machine, which has been procured, which is then going to be installed into our remodeled Central Sterile Supply Department, which is ongoing currently. And we're hoping to get all of these repairs up and finished within the next few days' time.
Good evening and welcome back. I am your host, Dr. Monique Lescott. Our topic for this evening is sexual safety, STD, and HIV awareness. I have with me my guests, Dr. Matthias Offrey and Mrs. Lucine Pemberton Vaughan from the HIV/AIDS Secretariat. We are going to continue our discussion. And Dr. Offrey, I'll hand the floor back over to you.
Thank you once again, Dr. Lescott. It's always a pleasure, and I think this is an opportunity for us to really make the people understand what HIV and how prevention, how we are providing level of prevention and how we want to inform the people on how to protect themselves. Nevertheless, we can only bring more information based on statistics that have been provided by the UN. It is recorded that 246 persons are reported. We have 246 reported cases that are positive, and for new infection, we have about 14 new infections annually. And also for treatment coverage, we actually have 100% diagnosed, and those diagnosed with HIV under treatments, and those that have achieved virus suppression is about 62%. And for testing rates, ensuring that all persons that assess health require or ask for testing, achieve that testing. Screening, we have 100% of persons, adults, that assess testing, HIV testing. Mm-hmm. And this brings also the fact that what brings us to the aspect of what we've achieved so far. And we've achieved nearly universal ART, that's antiretroviral treatment, coverage of 63%, and the highest rate of virus suppression to the point of 84%. Yes, and for us to achieve this goal of the UN, the World Health Organization goal of ending AIDS in 2030, we are working with a goal, with a target of 95, as I indicated earlier. The 95% of persons that are diagnosed, 95% of persons that are under treatment, and 95% of persons that are virally suppressed. So how are we achieving this robust target? We are doing it by ensuring that we have a decentralized testing. We also have accessible treatment in terms of medication, and it is free.
I was about to ask, how is that possible? Aren't they expensive? We need to appreciate how expensive medications are on the market. So especially to achieve, as you said, virus suppression, I would also like you to elaborate and explain to persons what exactly is virus suppression, because I know persons would hear the term being tossed around and might not be sure, and I think this is an opportune time to explain.
All right, thank you so much for that. So if we're talking about virus suppression, all our body we have what we call CD4 count, right? So a CD4 count is a cell that actually fights against infectious diseases, right? And when your CD4 count has a percentage that's required of each person to be healthy, so when there's a deplete in that CD4 count, as such, your body is overwhelmed by whatever infection that you're being infected, like HIV. And so, for example, when somebody's been infected with HIV and they're under treatment, they take the medication adequately and properly as being prescribed. So instead of the viral load, the CD4 count dropping, it will go back to a level,
normal.
Yes, normal, where they live a normal, healthier life.
So then in that time now, it's not detectable if you take an HIV test, would it be?
Yes. So when your viral load is suppressed, it can be suppressed to a level where it can be undetectable, and undetectable equals untransmittable.
Oh, okay.
All right. So in other words, when you are virally suppressed, right, and you are taking your medication adequately, the chances of you transmitting that infection to somebody else is absolutely none.
But then, can I ask you, would you still, as a counselor, encourage persons to still have that discussion with their partner? I'm HIV positive and I'm on my medication and I'm virally suppressed at the moment. And do you encourage persons to disclose all of this? Because I've known of, persons might think because they're suppressed that they're not obligated to say. But what do you think? What's your take on that?
I think that persons must feel free to share. It is my right, and we are speaking about rights. It is my right that I know what is happening with you, so that I will know how to behave in this relationship. It is really my right to say yes or no, I am not willing to take that chance. But we have to create that environment, which comes back to stigma and discrimination. People don't feel free to share because of the harsh treatment that they receive. And we are saying that we want to finish away with that. We have too much knowledge out there for people not to understand that HIV can be managed like another chronic illness. You just have to take your meds. And with you being virally suppressed, we are not saying that you must throw out the condom use, because there are...
You can be reinfected. And the reinfection is actually worse.
Very good. Right.
So the thing about it is that, just to throw a little bit to what my colleague just rightly indicated, when counseling, we ensure to encourage a person to communicate efficiently with their partner, all right? Because it's important that you inform your partner of your status. That's why we encourage people to know your status. And if you're in a relationship, ask your partner, have this conversation about the status. And that brings us to the theme of this year, World AIDS Day. The right path. The right path. In other words, everybody have the right to protect themselves. Everybody have the right to actually ask, information and also receive treatment. Everybody have the right to not be discriminated. And as my colleague already indicated, stigma and discrimination has been a stronghold and a factor that is affecting people from accessing health services as well as testing. But HIV, as my colleague rightly indicated, is more of like a chronic disease. Because in fact, most persons are dying of other more chronic diseases in comparison to HIV.
That's true. That's a worldwide fact, actually. But do we have HIPAA laws here that we acknowledge, enforce? Is HIPAA a thing here?
HIPAA laws. We have only, there are laws for violence and you know, protecting people from violence.
But as you said, discrimination.
In discrimination, I'm not certain if we have a law that actually prevent that. However, I think as we all expose information these days, all right? So it's important that we get ourselves informed. I feel people that showcase discrimination, it's as a result of lack of information. So if you have the information, it will be difficult for you to actually discriminate, because you know that by me shaking your hands, by me rendering services to you, is not an avenue for me to get infected. Sure. So it just showcase care as you care for any other person, by not, you know, instead of you making the other person feel uncomfortable. So let's create an environment where everybody feel respected, everybody feel valued, and everybody feel loved, and everybody feel like they belong in this fight for against HIV.
I definitely agree. So in terms of the statistical analysis for our own local population, is it we have those available, or?
Yes. Doc, you said that we have about approximately 246 persons.
But that was from WHO, so...
No, that is UNAIDS, because what happens is we get this data and we submit it to something called GAM. You know, we submit this information to UNAIDS. So for this information is ours. The data are represented is for the Federation.
We have to let them know that this is just the tip of the iceberg, because you have to multiply this by 3 or 4. Because you have to
like
account for those who did not partners and yes.
Because the thing about it is that yes, we have this number value that is being presented, but it is an estimated number, because not everybody is tested.
That's true.
All right, that's why we encourage that everybody should know the status. Everybody should come out. Everybody should seek to know their status. And it is not, it is available, and as you say, it is free. In some other countries, you have to pay for this.
Everything.
You have to pay for the test, you have to pay for the treatment, you have to pay for the care, and even for the counseling. Everything you have to pay. But in St. Kitts, thank God for the Federation, thank God for, you know, the governments that have ensured that the services that we render to the Federation, the people of the Federation, it is free, available, and it is accessible.
That's awesome. So this brings us to the segment of our show where we will open up the phone lines. I know there are many eager persons out there who may have questions. Now is your opportunity to call in and get expert advice and answers. Are we going to display the phone numbers? The call-in number you can call at 466-2666 or 662-8674. I'm also seeing 767-4765. We have an overseas line. We have a 1-239-645-4500.
I guess while we're waiting on them to call, we can just proceed.
Yes,
just
we can. Yes,
informing the people
we can
on
continue with our
what
discussion.
we're doing. We've come to understand that we have to start from the from the foundation, which is the primary stage of informing and educating the public. We go to the primary school, the high schools, even to college, to actually inform them, educate them in the aspect of abstinence and prevention.
This sounds like you guys have a whole team of people to do all of this work. So I'm hoping and guessing that your department has at least 50 persons to do all of this dissemination and tasks. And who is going to be the one to do the statistical? Because you're going to have to do questionnaires, quantitative and qualitative research. Like, that's a lot of work. Who is doing it?
Yeah, we do have 2 health educators. Miss Salome Penifeda, she's part of the team. We have Miss Londi Lennon, she's part of the team. She is the M&E officer that gets all the data. We also have the epidemiologist that gather all the information and also help us with all the data.
Wow.
It's a lot of work, but we find a way. Yes, and the National Secretariat is just 3 persons, you know, in response to this. However, we we work with our colleagues to actually ensure that all these activities being carried out. You know, you have to work smart and not hard. And we've been working together as a team, the health promotion unit, to ensure that every services we render, not just HIV, not just nutrition, not just NCD, but we work together to ensure that the services rendered to the population, to the Federation, it's what is required, standard, what is required. And we've been doing so much in terms of going to the schools. I'm telling you, in fact, Nurse Shalomi Pennyfeather, she was in various schools for the past 2-3 weeks now, going to different schools, actually educating the young ones about what HIV is, how it can be transmitted, how it can be prevented, and the need for abstinence. Because of lack of information we have, in fact, we had a 13-year-old, a 13-year-old that is HIV positive, that on the treatment. So we want to ensure that we want to remove and possibly eradicate that exposure. And most times it's because of they lack the knowledge on how to protect themselves and how to stay away from, you know, all these things that might predispose them to infection. And we've been doing that. In fact, we've been partnering with the Student Parent Teachers Association to ensure that we educate the parents as well. Charity begins at home, so we educate the parents and to ensure that the parents... So they know who to reach out to if there's a situation, exactly. If they need counseling, they can call you. They can always call. Yes. In fact, they call her. Even last year during the carnival, the young ones call her to ask her, what do you think about this? What should I do? This is what this boy is asking. What should I do? And she's there to provide that counseling, to ensure that the service... Where were you when I was growing up? I needed someone that I can just call and be like... It is very important that we fight for our young ones. We fight for the people who provide the information. In fact, in business places, both government and private business places, we are being called to educate them. We are being called to render health screening for them. That's HIV and other STIs, and as well as even NCDs. We do screening in all these business places. So feel free, call us, and we will be there to provide our services and to ensure that, yes, you cannot leave your workplace to the health center before they close. We can come to you and ensure that you do your screening and know your status and know that for sure you are safe. I really, really like the fact that you guys are willing to go out into the public and just work with the different business places and the organizations. And I really think that that really helps to bridge the gap. So then I have more faith in what is being reported statistic-wise, because then it means you guys are really doing the field work and you guys have the knowledge and the tangible data to prove what you're saying. So I have faith and confidence in everything you guys are saying. Once again, the phone lines are open, and we only have a few more minutes for the phone lines being open, so you guys can call 466-2666 or 662-8674, 767-4765. Overseas line is 239-645-4500. So we'll continue the discussion. Where are we? So in terms of the testing, which ones do we use? This is the rapid testing, or do we use other means as well? Yes, we do have the rapid testing, and also we have the mouth swab, right? Okay. So for those that are scared of the little prick, right? Just a little prick. Just like I prefer the swabbing. I didn't know that we have notice that most persons are scared of the little needle, so we ensure that we use the swabbing to give an accurate result as the pricking would do. All right, so we have that services available, and also we also do the blood drawn that will be done in GNF in the hospital setting. All right, so when we're out there, we ensure that you receive every services that we can offer. So most parents, when they're going to when you guys go into the schools, they don't mind this. I mean, it's kind of an adult kind of subject matter for primary school children. So I'm hoping that the parents don't mind or are supportive of such subject matters being discussed. We have a caller. So apparently we have a caller. Go right ahead. What's your caller? What's your question? Good night. Oh, we lost that one. Okay, so...
Yes, so sexual health should start from the womb to the tomb. Yes. As young as a child, maybe they have to understand boundaries and setting that space, that personal space, and parents saying, don't let anybody touch you.
Good touch and bad touch.
Good touch and bad touch. And if they tell you don't tell, then that's the time you should yell. And all of these, we should be telling the children at an early age. There is no secrecy. As they grow older, we start to tell them about puberty, because children are reaching there much younger now.
That's true.
We have children at 8 and 9, and the feelings will come because of the hormonal changes. And so the first agent of education should be in the home, so that the children grow to understand that these feelings are normal, but they are for me to control.
Of course.
How do I control it? I mean, what do I do when these urges come upon me? How do I act in the presence of the opposite sex? And parents have to build the child's self-esteem. So it's not an adult subject. As a matter of fact, parenting is a lot more difficult now with the cell phones.
It's more difficult to control what the child is exposed to, for sure. So I definitely understand that part. So I'm hoping, I'm guessing that the parents are in support. You don't get any negative feedback from parents?
Not really. Well, not that we have people that come across persons that are lack the understanding, but we bring clarity to them. You know, understanding that it is not the act of we trying to bring sex to the mind of the people, but actually educating the young ones on how to protect themselves from predators and actually people that might violate and also abuse their innocence. Now we have seen that happening over and over, and they are predisposed to STIs and other infections that they shouldn't. All right, so as such, we're using that opportunity to actually bring clarity, and that's why I really enjoy the Parent-Teacher Association forum, because it brings clarity. In fact, we're in a forum when we're talking to the young ones, and the parents were there, and the mother say, "Oh, that's my baby." I say, "Yes, it's a baby, but you have to make sure that your baby is not somebody else's baby, because it's very important that we act being ignorant and as such predisposing our children to risky behaviors." And you feel that things may not be happening, but things are happening that might be predisposing them to things that they are not supposed to be exposed to.
It's true. It's true.
Right?
I definitely agree. I see here that you guys have certain...
All right, we have a caller.
We have a caller? So we have a caller?
We can't hear.
We can't hear you. Oh, I think we lost that one too. Wow. We lost that one. So I see here that would be part of your retention programs, right? That's
yes.
Going into the schools. And so then how do they have access to the ART drugs though?
All right. So for the ART, let's say, for example, somebody's been...
we don't have to elaborate all because we're going to go on commercial break. I just wanted to put a thumbnail on that one.
Okay. So the ARVs, we have 4 preferred doctors that we work with, to provide health treatment to those exposed to HIV. And as such, those persons will be linked to a case manager, and a case manager to...
Hey, when we come back from break, I need the public to know that one. We can't watch that one at all. I need the public to know what the chain of communication is if they have a concern. So we'll have a quick commercial break, and we'll be back after our sponsors.
We never know when a storm may strike, but we can be prepared. At SCALEC, we work tirelessly to keep our customers connected. When a storm is approaching, we activate our hurricane preparedness and response plan. After the storm, our response teams will assess the damage to our network. If you are daring enough to go outside after the storm has passed, don't touch any downed power lines and stay clear of sparking wires. We'll need you to remain patient as some restoration work may take longer than others. Before restoration work begins, we will fix any damage to our power plant and transmission lines. Then we'll restore power to priority areas, beginning with essential services like hospitals, police stations, and water pumps. After that, we'll restore power to the largest number of customers on one feeder, which will take the shortest amount of time. We will then restore power to smaller feeders and individual customers with isolated problems. Be sure not to worry. Skelec is right here with you when you need us most.
And welcome back. I am Dr. Lescott, your host. Our topic for this evening is sexual safety, STD, and HIV awareness. I have here with me an expert on the subject matter, Dr. Matthias Offray and Mrs. Lucine Pemberton Vaughn. So we're going to continue our discussion we were having. We're going to elaborate before we went to break. And I need you to let the people know, how do they access the treatment and the chain of command?
Thank you so much, Dr. Lescott. Just to bring a little light to that, when a person, for example, is diagnosed with HIV, they are linked to a case manager. And a case manager then relay that information, link them up to the 4 major health doctors, physicians that we work with, and that provide treatment for them. And as such, that's the concept at which we know the management structure, all right? And as such, they are maintained through the preferred physician. So we have those preferred physicians so they can easily assess whoever they choose, whoever physician they want to work with. And the physicians we have are Dr. Alan Ferdinand.
We have a call?
Okay, we have a call.
We're losing all our calls.
All right.
No? Sorry, okay.
Sorry, we lost that call again. So try again, caller. So we have Dr. Kelly and Alan Ferdinand, and we also have Dr. Busiri Sehili. We also have Dr. Marvin Laws, and then we have Dr. Wharton, and he's also the clinical care coordinator. So those physicians are the physicians that you can always reach out to, and when that will be referred to. However, I want to bring those are not the only patients they see. All right, so don't have them stereotyped to just that treatment HIV. So I just want to bring that notion. All right, clear that notion there. So after a case manager, and then they're referred to the treatments, which is the physicians, and then we ensure that they are maintained. All right, and that is the process at which we ensure that they are taken care of, and people have been adhering to treatment, and we are doing better and even advancing our services to ensure that we actually ensure that people that have been exposed to HIV live healthier and longer lives.
I like that. So we're going to move on. My colleague, you identified a particular topic, or subtopic that you're very passionate about. So you're going to tell us some of your challenges that you have experienced while you've been in the field.
One such challenge is I don't understand how the age of consent is 16 years, yet those 16-year-olds cannot access treatment or preventative services until they're 18.
Or without
an adult. So how can we tell our school children, because they're in school at 16, that you cannot, that you are now ready to have sex, that you can consent, but they cannot get condoms from the health centers without mommy coming with you. You cannot get tested, but you can have sex. You cannot get tested unless you bring mommy, or until you become an emancipated minor. So what we are really saying is that you can have sex, but you can't have condoms
You can have sex, but you
until
can't
you
protect
can get
yourself.
pregnant. I mean, until you get pregnant.
Okay.
Yes, because
Yeah, because that's an evidence, right?
You are now an emancipated minor, right?
Okay.
So you can go on and have sex, but no condoms for you. You can't get tested until.
So I think that's such a disservice to our youth. So then we're telling them they are at an age to consent for intercourse, but they cannot protect themselves from what comes with intercourse.
So we need the balance on the books to bring up the age for, I am advocating for the age to go to 18. Because you cannot vote until you're 18.
That's true.
You
are still in school.
Drive. You can't get your driver's license until you're 18. And I'm saying that you should not be consenting to sex
until you're
in
18.
school anyway. So
that is true.
18.
I want to add to that. I think that is predisposing the young ones to even
abuse
and risk, higher risk. In fact, that can even affect their economic growth because if they are pregnant, that alone can limit them from further education. And as such, that can even affect them psychologically. So I think we have to get to a point where we come to a balance and figure out what is best for the next generation, what is next for the future leaders, because they are our future leaders. How can we protect them? Because look at it, HIV can be, as we indicated, HIV can be in your body for up to 10 years. If they start being intimate at 16 and not tested until when they're 18, by the time they get to 18, possibly it's instead of being just HIV infected, but that would have progressed to AIDS.
Yes.
You understand? And that alone is something that we don't want, really. So for us to prevent that, we have to come to a point to agree on an age that will be more idealistic and more practical to protect the young generation or the young adult from being exposed to diseases and such as HIV and keep them safe and sound. Because yes, we've been doing our best to go to the schools, but we know some of them. Let's come to the developmental stage. Each individual have different level of development, right? So we have a 16-year-old that acts like, behave and is matured and acts like 18, 20 years old. There are some that are more, especially the young girls grow faster in terms of maturity than the boys. So they are predisposed to abuse and are predisposed to want to experiment. All right, so if we put it to a point and say, as I agree to what my colleague is saying, 18, because they are still in school, and that will eliminate teenage pregnancy, that will eliminate increase in infectious rate for young population, that will eliminate the chance of them being psychologically influenced and affected. As such, we will have vibrant, hardworking, and also mind-driven, positive-driven minds of the young population.
I definitely agree, because that is a very how should I say it? That age of consent across the board has been a ticklish issue, and it has been a point of sore thumb for many issues, not just about the HIV and accessing of treatment, but in a lot of other areas. The age of consent is actually, I personally feel that 16 consent is like a breeding ground for predators, maybe even sex trafficking. It's like an open doorway, because a person who knows that loophole in the system can fully take advantage of that. And so the young person who is being taken advantage of probably wouldn't have much recourse.
Right.
And so we're putting them at a disadvantage, and I feel like society would be the one to absorb the casualty of whatever that is. So I think that's a good idea to eliminate that loophole sooner rather than later.
And at that age, they're not even developed enough to make a well-informed decision. And as such, those that are adults can prey on that.
That's what I'm saying. It's a vulnerability.
And then, sub in and as such affect them.
And then they don't have a recourse.
Yes, without understanding that in the next 2, 3, 4 years or 5 years, that child will grow up affected by what an adult have done.
It's true.
So we need to come out to actually start protecting the young ones by the decision we make, by whatever laws we put in place to ensure that the young ones are protected.
Because if a young girl becomes 15, become pregnant at 15 or 16, so what we're saying is unless she has her guardian, she cannot go for prenatal care either?
I think the pregnancy makes you
emancipated.
Yes.
You're automatically
So
emancipated once you become pregnant.
Yes.
So I really didn't know this. So forgive my ignorant questions here.
No,
okay.
it's okay. We all learn because if you look at it, we need to we need to really discuss this further because I am telling you there are issues that surround these that greatly affect the young ones. In fact, we've noticed a little increase in teenage pregnancy, and we can eliminate that by actually ensuring that the young ones are protected and keep them safe and sound.
Gotcha. So we're going to come back to our discussion. We're going to take another segment to look at the progress at the Joseph and Franz General Hospital. We're going to also hear again from Dr. Jensen Morton with some more health services news.
Okay, so we're here on the private ward now of JNF General Hospital. So it's actually been closed for a bit of time to get some renovations done, and it's going to be closed for just a little bit longer because whilst the CSSD is undergoing its renovations, the team from the Central Sterile Supply Department, they actually are working from an area in the private ward that we have reconfigured to be able to perform that task. So it's not ideal, 100% ideal, but the staff has found their way to make it work. We're very grateful for that. When the CSSD's repairs are complete, the team will be able to move back to their new location, and that's when we'll be able to retrofit the final part of the private ward for that then to be open for the general public. So we are waiting for all of the things to progress smoothly.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing. But hope is remaining. And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para cortar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
My viewers in YouTube and TV land, welcome back. My name is Dr. Monique Lescott. I have here with me Dr. Matthias Offray and Mrs. Lucine Pemberton Vaughn. The topic for this evening is sexual safety, STDs, and HIV awareness. We're heading into the carnival season. We want you guys to stay aware, stay conscious of your surroundings. Don't be careless and don't make any reckless decisions while you're under any influence of anything of the sort. We want you guys to be safe. We're going to continue our discussion. Mrs. Vaughn, we're going to elaborate on what we left off before the health news. So can I take it back over to you? You ready?
We were speaking of
the challenge of age of consent.
Yes.
So.
And we have yet another one with stigma and discrimination, especially against the key populations, the men who have sex with men, the sex workers, the transgender. And this year's theme is taking the rights path. And we are saying that when it comes to one's sexuality, that persons have the right to choose which orientation, which their sexual orientation. And we are saying that the harsh judgment that they face sometimes make them angry.
Of course.
And when they know their status, that might not work too well for the general public. So we are advising persons to be easy on them, knowing that we have rights, they have their rights
too.
and our rights are the same. Treat them as normal human beings as they are, and let them live the life that they choose as we live.
Yeah, we have to view it this way. You know, people are totally different. I could choose to put on a red shirt. You can choose to put on a black shirt. You could choose to put on a white shirt. It all varies. It's your right to choose whatever you want to choose. All right. So because a person chooses to go a certain way or act a certain way, it's not enough reason for you to justify your stigma or discriminating them. So we're saying to the public that respect everybody's right, because everybody truly have a right, and we have to ensure that everybody is carried along in this fight. We don't care whatever you are, the LGBTQ community, the key population, whoever you are, we just want to let you know that you are respected, and we all need to respect everyone. And that brings us to the light of the World AIDS Day. All right, the World AIDS Day, which was the Sunday, which is the 1st of December, is always recognized as World AIDS Day. All right, and as my colleague rightly indicated, the theme is choose the right path. In that light, we are acknowledging the World AIDS Day by the World AIDS campaign that we normally have each year. And this year, we're having the World AIDS campaign. We're having the screening going on, HIV screening, that will be happening in the square on the 6th of December.
That's this Friday?
This Friday. And in collaboration with the Men's Health campaign, we're having other things that will be going on there as well. That day, we're having blood pressure checks, sugar checks, prostate screening.
All for free?
All for free. So come in and ensure that you get you know your status, you check your blood pressure, and also other services that we render as well. Also know this, despite the fact that we are having this push to ensure that everybody knows their status, it is your responsibility to ensure that you seek health. You ensure that you seek for the services that you really need. Don't wait. People always say that if my partner check, I am good. It is definitely not right, because everybody have
the physiological responses will be
precisely
different.
In other words, as well as you know, you really don't know who exactly that person is going with. So we are encouraging that you protect yourself by knowing your status, and don't wait for tomorrow. Ensure that you know your status today, and come on Friday the 6th of December. Come to the square, Independence Square, and get your status. Know your status and get tested and know your status. And remember, we have condoms available, and it is free. Condomize this season. Protect yourself is very important. Don't make reckless decisions. Don't be overwhelmed by the environment. Ensure that you are in control. Think with your big head, as you rightly say, and not your small head. It is wise to ensure that you protect yourself. Be wise, be matured, and make a well-informed decision.
Thank you very much, Dr. Ofre and Miss Lucine Pemberton. I really appreciate you guys for stopping by. So it was a timely visit. And so this concludes our final session, our final show for 2024. I thank you guys for having me. I wish you guys a happy holiday season and a safe and festive carnival.
Thank you so much.
Thank you.